Glucagonoma is also known as hyperglycemic cutaneous syndrome. Why? Because there is excessive production of glucagon, and because of that patient is going to develop what? Hyperglycemia. Cutaneous means the patient is having dermatitis, that is also known as necrolytic erythema migrans. What's the most common site of glucagonoma? And the most common site is body and tail. Body and tail. It is more common in females, and the average size at diagnosis, it is usually larger. And how much is the size? 5 to 10 centimeter. Average size, that is 5 to 10 centimeter. So what percentage of glucagonoma is malignant? 50 to 80% of glucagonoma are malignant. 50 to 80% of glucagonomas are malignant, and 80% patients with malignant glucagonoma have liver metastasis at the time of diagnosis. So if patient is having malignant glucagonoma, 80% of patients with malignant glucagonoma, they have liver metastasis at the time of presentation. Liver mets at the time of diagnosis or presentation. Time of presentation. Okay. Most of the glucagonomas are sporadic, but it is also associated with MEN1. In what percentage it is associated with MEN1? In 5 to 17% cases. It is associated with MEN1. Otherwise, majority of cases are sporadic. Now this glucagonoma, it is associated with glucagonoma syndrome, that is also known as 4D syndrome. So what are the components of 4D? First is diabetes mellitus, there is dermatitis, DVT and depression. Out of these four, which one is the most common presentation? And that is dermatitis. Dermatitis, this is the most common presentation. And in what percentage of patients we are going to find dermatitis? It is seen in 2/3 of patients. What is the other name of this dermatitis? This is the most common symptom. Its name is necrolytic erythema migrans. And this necrolytic erythema migrans, it is caused by severe amino acid deficiency. How it looks like? So here you can see this is necrolytic erythema migrans. And this necrolytic erythema migrans, this is the most common symptom of glucagonoma. This is most common symptom of glucagonoma. So here you can see the patient is going to develop rash. And what is the site of rash? It occurs in the areas of friction. These are migratory. That's why the name is migrans. Migratory. And you can see the appearance. It is red and scaling. Or these are associated with intense pruritus. So it occurs in areas of friction. These are migratory, red and scaling, and associated with severe pruritus. Deep venous thrombosis, in what percentage of patients we are going to find this DVT? DVT is seen in 30% of patients. So question here which is asked frequently, most common symptom of glucagonoma, that is necrolytic erythema migrans. These patients are having diabetes mellitus, but this diabetes mellitus is mild. Why this diabetes is mild? Because the insulin production is normal. There is increased glucagon production only. And that's why, because of normal insulin production, it is not associated with diabetic ketoacidosis. Insulin secretion by beta cells is preserved, so it is not associated with diabetic ketoacidosis. So diagnosis, we discussed in gastrinoma that the level of gastrin, and in glucagonoma, level of glucagon, if both are more than 1000 picogram per ml, usually it is diagnostic. Here it is diagnostic in glucagonoma, and in gastrinoma it is highly suggestive of diagnosis. So fasting glucagon level more than 1000 picogram per ml, this value is diagnostic. This is diagnostic. And we discussed that VIPoma, glucagonoma, somatostatinoma, these are larger at the time of presentation. So these can be easily localized by CT or cross-sectional imaging. Now in the treatment, we discussed that glucagon is a catabolic hormone. So glucagon is a catabolic hormone. It means glucagonoma is severe catabolic state. And if glucagonoma is a severe catabolic state, these patients are having what? Weight loss. These patients have depletion of fat and protein stores, and there is vitamin deficiency. So what we have to do in the treatment, see the treatment. Glucagonoma, it is the severe catabolic state. It's a severe catabolic state. Means these patients are having weight loss, there is depletion of fat stores, protein stores, and vitamin deficiency. So the treatment of this severe catabolic state begins with medical therapy to improve. What we have to start? Medical therapy or medical treatment to improve the nutritional status. We have to improve the nutritional status of patient. So what we have to start? We have to start supplementary enteral nutrition. Simultaneously, we have to give IV infusion of amino acids. So supplementary enteral nutrition, supplementary enteral nutrition. And what we have to start? We have to start IV infusion of amino acids. IV infusion of amino acids. We have to start. Why? If you give IV infusion of amino acid, it is given to reverse the symptoms and it is going to improve dermatitis, because we discussed that necrolytic erythema migrans, it is caused by severe amino acid deficiency. Second, patient is prone to develop DVT. So in such patients, we have to start DVT prophylaxis. We have to start DVT prophylaxis. Now, what is the treatment of choice? Obviously, if the patient is having resectable tumor, the complete anatomic resection for resectable disease is the treatment of choice. And you know that if the tumor is located in body and tail, what is the treatment of choice? So obviously we go for what? Distal pancreatectomy. So treatment of choice is distal pancreatectomy. So what we perform, actually the complete anatomic resection of resectable tumor, we perform distal pancreatectomy. Now see the prognosis. After resection, 5-year survivals without metastasis, that is 85%, and with metastasis, that is 60%. After resection, 5-year survival without metastasis 85%, with metastasis 60%. So this was all about glucagonoma.